I've always been active. I like to, hunt and fish, but mainly hunt. No, I've been hunting since I was a kid. Almost every spare moment I got, I went hunting. It's just been with me all my life. I probably never did less than 5 trips a year, ever.
We had an appointment with the cardiologist, and they did discover that he had Afib. And I could see that he was just not feeling quite his normal self and didn't have that desire to do anything.
I was down, physically and mentally. I don't know how to describe it other than I want to know what's going on, and I didn't feel good.
Atrial fibrillation patients feel that sensation of a very rapid heart rate, and it's much like panting when you breathe. If you breathe so quickly that you can't take a full breath, you start to get lightheaded. Similar with the heart, if the heart is beating so fast, it's not efficient, and ultimately they can go into heart failure as a result of that.
Naturally, I'm starting to think, God, I'm never going to be the same again,
It was hard, hard to see him go through that.
There are little tiny centers in the heart which are firing impulses inappropriately. And what we're trying to do is corral those impulses off to keep them away from the normal heart tissue, so the normal heart tissue will continue to beat in a normal way. The problem with it before has been it's been what we call a cut and sew technique, where you actually had to physically cut into the heart and then sew it back up together to create the barrier for these irregular rhythms to stay in one area or another.
There's always hope, that some procedure or some doctor will come along, or that we could find somebody that could help and solve the issue. Luckily, we found that. They discovered another blockage, and they came up with the suggestion of this procedure that Jack had done, and he had a bypass also at the same time.
We work in conjunction with the cardiologist, and they usually diagnose the problem, which is either valve disease or coronary disease. But once we've established the fact that they have atrial fibrillation, then we include that part of the procedure, the maze operation, with their standard operation. The maze procedure itself was designed many years ago. What's developed is a radio frequency device, which actually, much like a microwave, will burn areas of the heart, creating that scar without having to cut and sew that. Our success rate is somewhere between 85 and 92% success in getting them out of atrial fibrillation, and it's overall a safer operation for the patient.
Well, it took probably 2 months to actually see that he was coming back and feeling much better. But then he just started getting stronger and stronger and better. I've got a medicine cabinet full of things that he used to be on and is no longer, which is a very, very good thing.
Before, I just didn't have any enthusiasm. All the enthusiasm was gone. And now I got it again. I never thought I'd do 5 hunts a year again like I'm going to do this year. I'm ready to go all the time. I'm excited every trip I go on. Kind of like a little kid, really, what it boils down to.
I see the results of my patients' lives afterwards, and once we can correct their irregular rhythm and they can have a more active, normal life, that makes me very passionate to try and continue to treat them.
No, there's no downside to it. It's all up. It's the best thing I ever did. I don't regret any of it at all, period. It's a world of difference.